Welcome, my name is Dr. Haidaria from Harley Street Dermal, and today we're talking about lip filler treatments. So a lot of my clients ask us about the lip fillers, how we do them, the techniques used, and also I'm just going to address a couple of the common stereotypes that we get from our clients about lip fillers. So a lot of people bring us photos from Instagram or Facebook about how lip fillers can look big and pouty. And while some people do treatments in that way, and those treatments do exist, it's actually the minority of people who actually have big, fake-looking lips. The vast majority of people who get lips done get it done in a way that's minimal and as natural as possible. And for us, it's a very simple ethos. If you can tell that someone's had their lips done, then it's a bad result. So for us, it's all about hydrating, structuring a little bit of volume, a little bit of shape in a way that just doesn't draw attention to the lips in particular, but it just actually provides a bit more balance and a bit more healthy looking appearance for the lips. So the main couple of variables that we have with lip filler is how much filler we use and the techniques that we use. So in a nutshell, the techniques used are split between needle and cannula. So needles are often very small, sharp needles, as you know, and they can cause more trauma, more swelling. They can be quite useful for areas like the Cupid's bow, where you can't really use a cannula in these areas, or providing a little bit of extra volume loss in the midline, for instance. But by and large, needles cause more bruising, more swelling, and they can be more painful, so it can prolong the recovery process. Also, the main disadvantage of needles is that sometimes, in a very small number of instances, boluses, so just little blobs of filler can be injected, which lead to lumps. Often, sadly, I spend a lot of my time correcting lumps from other clinics and other practitioners with less experience, so often the needles can present an issue from that perspective. Now, the cannula for me is the much more preferred option. It's much more conservative in its approach. We only have a couple of needle entry points right from the corner of the mouth to go below and above, so the marks are hidden, the swelling is less, the pain is less. You're injecting in kind of threads of filler just to go along the contour of the lip in the border or the body, so you're much less likely to have these little pebbles or lumps with cannula technique. And by and large, anesthesia is actually really important to discuss as well. We often tend to anesthetize the lips by doing a partial infiltration block using lidocaine in the gums area, which is above here in that area. That often can numb the lips up much better than just using numbing cream, which I think a lot of clinics still rely on, which I don't understand why. The point is, the anesthetic can be quite effective in this area. And it's important to note that the better that anesthetized the lips are, the less the swelling and the less the trauma will be, so the faster the recovery process. The other factor that we're talking about is the amount of filler used. So 0.5 ml is often the starting point that we recommend for most people who are a little bit apprehensive or unsure about what they want. 1 ml is a bit more for those who are a bit more confident, or for those who've had treatment before and know what they want. The analogy I use is like if you're wearing a swimsuit and you're about to go into a pool and you have no idea how cold the water is. Some people just dip their toe in the water just to feel out the pool, and that's the equivalent of the 0.5 ml option. Some people just jump into the pool like a cannonball effect, and that's just, all out kind of thing, and where they do 1 ml and they feel more confident just doing it properly all in one go. Often people who do 0.5 ml often need more, but it's more about the comfort as to how you do the process, and actually putting small amounts of filler for some people is a more comfortable process than just doing 1 ml in one go. Again, there's no right or wrong answer, it just depends on what your particular needs are. And that's really the lip filler in a nutshell. And as I mentioned, the main points really is just the techniques that we use can be varied. We often use a combination of needle and cannula. The volume, amount we use, there's no right or wrong answer, it just depends on what you feel comfortable with. But most importantly, the fact that lips can be done to enhance your overall appearance and refresh your look, not to make you look big and fake and obvious. And it can be done against the stereotypical grain and in as natural a way as possible. So it's really important to note that. Thank you so much for watching. Please let me know your comments below.